Well, good afternoon, everybody. Very happy to invite you to this session on psychological health at work, an extremely big issue at the moment, as I'm sure many of you are aware. And I am delighted to have with us today two experts, Peter Kelly from the Health and Safety Executive and Aditya Jain from Nottingham University. Many of you who've been on the conference for the last couple of days already know who I am. So very briefly, I'm Sally Swindwood from BSI. I'm a lead standards development manager in the area of occupational health and safety. And I also manage the ISO committee in this field. Peter, would you like to introduce yourself?
No, so I'm Peter Kelly. I'm the senior psychologist at HSC, principally involved in mental health and well-being, stress, and I'm also a warranted inspector. So I spend my my days doing that, and then I've had the privilege at times of being a part of 45,003, and it's a wonderful journey.
Thank you very much, Peter. Aditya.
Great. Good afternoon, everyone. I'm Dr. Aditya Jain from the University of Nottingham. I work at the business school as an associate professor and head of division for the organizational behavior and human resource management division. I've been sort of working in this area, doing research on well-being at work, mental health at work, focusing on policy issues for the last 15 years. And I have been working with BSI and standards bodies since 2009, developing standards like PASS 1010. And since sort of this work began on ISO 45003, which we'll talk about during this session. So I've been actively involved in this and look forward to talking to you more in this session about this standard.
Thanks very much, Aditya. So in this session, we are going to cover the development of the world's first global standard in this area, ISO 45003, which our panelists have mentioned. But we're also going to look at the particular aspects of psychological health and well-being during the COVID-19 pandemic, and hopefully give everybody a few practical tips on what to look for and what to do so that we can help support each other in this extremely difficult time. It's very challenging for everybody. So I'm going to begin by asking Peter, just how big an issue is psychological health and well-being at work?
Okay, well, let's start with the statistics. Actually, only released 2 weeks ago from the UK. 17.8 million days lost to work-related stress, and that equates to 862,000 incidents of work-related stress. If you consider the previous year, the numbers in terms of recorded sickness for those areas was around about, 14 million. And the year before that, it jumped 15 million. 17.8 is the biggest amount of sickness absence and days lost, and the 800,000 people off is the biggest amount we've ever had since we started collecting stats. Remember, this is only 1 week into the pandemic, these stats. So next year's stats will take on board the pandemic lockdown period. And at the moment, if you look globally across many countries, we're seeing a similar picture. So huge increases in stress at work, massive increases in mental health issues, particularly in the healthcare workers. You'll see behind me a drawing that was done by a Chinese artist in Wuhan about, and this for me is really a good way of looking at this, the psychosocial work environment. It's looking out for each other and looking out for the physical safety as well as people's mental health. Well-being is out there, and lots of people are doing lots of things about changing the individual. What I hope that this standard will do is actually put a structure around actually what you do, not just for the individual, but what you do at an organizational level. So that's the primary intervention, as opposed to tertiary interventions where you're looking after people. So it's a big issue. It's going to be an even bigger issue over the next 2 years. And I suspect the very essence of the way we work has changed, will change. So this standard and the timing of this standard will fit just into what is going to be a completely different place of work.
Thank you, Peter. And I heard there you mentioning the terms primary and tertiary. Perhaps Aditya, you'd like to explain a little bit more what they mean for our audience?
Okay, sure. I think, as Peter said, I think mental health at work and well-being, psychological health is a broad construct. It's affected by several different factors, both, of course, at the workplace and outside of it. And I think that's important to remember because it's quite broad, it's quite holistic. But when we look at psychological health and well-being at work, we try and look at aspects of work and the work environment that can be managed, what we call psychosocial factors. And the way we do that is by intervening at the primary level, which is basically aimed at prevention. So trying to deal with issues before they arise. So things like managing work demands, job redesign. The secondary level focuses on trying to build capabilities and abilities of people to be able to cope with issues that they might be already dealing with. So, of course, for example, now dealing with the huge increase in working from home and the challenges that brings. And the tertiary level focuses on rehabilitation. So when people do go off work ill, how do you get them back and reintegrate them into the work? So the primary, secondary, and tertiary focuses on how you deal with these issues at various levels. And of course, so when we look at sort of the research and the evidence around what works best, it's always a mix of these approaches. So prevention, of course, has to be the basis, but we can't prevent and avoid everything. So we have to deal with the consequences as well. So that's how primary, secondary, and tertiary works.
Thank you very much. We've seen in the news some very dramatic language in this field. Do you think it's a bit dramatic to say we're facing a tsunami of mental illness at this time? Peter?
No, absolutely not. This isn't a tsunami, this is a set of tsunamis that's coming along. We already have seen a 20% increase in depression and anxiety diagnosis in the last 6 months. That's on top of the average which we have. So normally it's 1 in 5 people experience depression and anxiety. I would hesitate to say we could be seeing 1 in 3 probably by within the next 6 months of people experiencing depression and anxiety, depending on how long the lockdown goes. But then actually the very essence, the way we work, the fact that work was a safe place no longer feels safe. Going to work is not actually, may not for some people not be a safe thing to do in psychologically. So what we've got to do, we're going to get compliance with in the new world of work and to reduce the spread of the virus, and that is we need to both address the physical barriers, put a barrier up between people in the office to protect them, but also the psychological element, which is what do you do to actually get people to be able to get through what they're seeing is happening to the through this pandemic. So this tsunami that you're seeing now is small. But it's the next one that's coming, and I'm not trying to be like negative, but the next one that's coming is huge. We are already seeing a massive spike. First of all, in the first wave, as we were preparing to go in, we saw a spike, and then we adapted, and then we came out of it. Now that psychological response in the second wave is markedly different. People know what's coming, and actually they just don't want to do it, and they're not looking forward to it, and psychologically they don't feel like they've been able to get over the first wave, and the second wave is coming. So yes, there is definitely a sea change in mental health. And here's the thing to remember: if you're experiencing mental ill health, you're going to also potentially be involved to do things which are going to lead to safety issues. You're going to have accidents because you're not concentrating and you're not doing. So we have to deal with both issues.
Thank you. Aditya, sorry, Peter.
Sorry, Aditya can go positive now.
Oh, I think, I mean, I agree. I think I wouldn't say it's dramatic at all. I think, I mean, the session title is absolutely apt. It is a pandemic before this pandemic. It's just that it's not always been recognized as such. I mean, I think the good thing in a sense is that there is far more awareness of this issue now than there has been over the past several years, and I think that's a good thing. People are more able to talk about psychological health or at the workplace. I think there's more awareness and a willingness for employers to acknowledge that work does play a role in people's in promoting people's psychological health or impacting it negatively. So I think I think there's better recognition that this is an issue that has to be dealt with. As I think Peter's already said, the World Health Organization shows that that mental ill health and common mental ill health, so things like anxiety and depression, are the biggest contributors to the global burden of disease. So I think it is, I mean, I don't think it's dramatic to say that this is a serious issue.
The predictions before the pandemic was by 2030 that depression would lead to the biggest levels of cardiovascular disease before the pandemic. And now we will have probably a period of 2 years where our lives will be directly impacted by that. So I anticipate that even the World Health Organization may have to change some of their targets. Remember this, that the mental health that you experience now does not show a physical health outcome immediately, obviously, unless you're experiencing extreme anxiety, then you get the physical symptoms. Many times the mental health we're doing now may actually come 10 years later, when actually, we find ourselves in a crisis with people's physical health. We talk about resilience, and we talk about mindfulness, and we talk about doing all of these things. But if we don't, as what I've said with Ali, is if we don't address the organizational bit and the individual bit, make your people mindful, make them resilient. But if you don't do that organizational structural bit, you might as well be putting them back into. Someone once explained it to me. They wanted clean fish in their pond. So they wanted strong, resilient fish in their pond. Their pond was their business. I said, what if the filter was broken in the pond? And it doesn't matter how strong your fish are, they're going to actually eventually collapse. So yeah, this is a wake up call. This is a wake up call for the world of work and the way we look at mental health.
So I'm deviating slightly from our slides here, just on that. No, I'm going to deviate. Just on the back of what you're saying, do you think our eyes are wide enough open now? We've had a lot of initiatives in workplaces around wellbeing over the last few years, and perhaps, in my humble opinion, too many of them are focused on yoga sessions and free fruit and nice things. There's nothing wrong with them. But like you say, if the filter in your fish pond is broken, then your fish are never going to benefit from having extra flowers in the pond, for example.
Unfortunately, I killed loads of fish in my pond. And it was the fact that I hadn't changed the filter. It wasn't a bad fish and it wasn't the water, it was the filter. And it is, I mean, I'll let Eddie talk because this is like my Hyde Park moment.
I think Sally, you raise an interesting and important, point, and I think it's good to talk about this now than later, because I think there has been, as I said, there's been more awareness, and what that's led is that it's obviously led to this huge explosion of activity, which is a good thing. The slight danger, though, is that a lot of this activity does not acknowledge what exists already and what is good practice. So I think, for example, there is a big misunderstanding out in the world of practice, and also I would say to a large extent even in the world of research, when you sort of look at management research as compared to research in occupational health psychology and other disciplines, where the concept of wellness, which sort of relates to more aspects which relate to health promotion activities, so yoga, fitness, and all of these things which are important, cover. However, well-being is a broader construct. So just to sort of, I'd like to put it out there. So well-being is an integrative concept that characterizes quality of life with respect to an individual's health and work-related environmental, organizational, and psychosocial factors. So it's not just one thing that leads to well-being. And I think to promote well-being, you have to look at it holistically. So something like, for example, an initiative to promote wellness would fall under a secondary intervention. So it's part of it, of course. It's part of promoting well-being, but it's just one part. And I think the analogy that Peter used around making fish strong, which is what yoga and fitness, etc., would do, does not necessarily solve the problem. It does help, but it does not resolve the issue.
Well, without being controversial, those things that we do tend to be the cheapest option.
And the simplest.
Yoga training, do the did you say pessimist? But isn't it ironic? You know, the things that you can do cheaply tend to be the things you just do where, you know, there's a low amount of cost. But here's the crazy thing about this whole situation. You are losing a mountain of money by not addressing the organizational and secondary issues in your workplace. And it doesn't matter how healthy and how people that, you know, I do mindfulness, I do resilience, I do that. But if I go in, if I'm in a toxic place, it doesn't matter. That's got to be addressed. Hopefully, this is what 45,003 sets out, is a roadmap of what you can do in terms of tackling it. You know, and you work through it. You adapt it to your own safety management system. But remember this: the health of people now is the biggest contributor to sickness absence in the UK. 6 million people had accidents, 24 million days lost to work-related illnesses. 17.8 of those is stress and mental health. So where are the issues? The issues are in the health of our people and health of our workers.
Okay, well, I think that leads us really nicely on to our next section of this presentation. ISO 45003 isn't for experts. It's not for psychologists. It's for the vast majority of the rest of us who aren't. But we still are living in this environment. It's still affecting us every day, and it's affecting employees. Managers are having to deal with their team members suffering. Organizations are having to deal with their managers who are suffering because they're trying to cope with their team members, but also the pandemic and all of their own life stuff. So let's have a look at some of the practical things you can look out for and some of the practical things that you can do. Aditya, do you want to start us off by looking at this idea of how workload can be an issue?
Yeah, I think it's quite obvious, isn't it? I think if we feel overloaded, and as we do now, I think most of us, regardless of which sector we work in, because of the pandemic, we do feel overloaded because we are working more. Online meetings increase work, I would say, not reduce it. So I think how we manage work and the acknowledgement of how that work is managed plays a key role in how we are able to deal with and cope with our work. And if we are unable to cope with our work over a longer period of time, it leads to issues such as work-related. So we feel stressed increasingly, and as we feel more stressed, that then has a clear link to other more severe mental health, ill health issues. I think, as Peter already said before, it does then go on to link with other outcomes. So it'll affect our work quality of our own work. So it'll affect our performance. It'll affect our ability to be innovative and so on. So I think managing issues around work and adapting and being able to deal with new technologies is a key part. And I think as the slide sort of very nicely puts it, I think managers play a key role. This is not something that we need psychologists for. This is about good management, improving the quality of work life, because quality of work life and improving job quality increases or has a positive impact on health and well-being, as one of the attendees has also pointed out. Quite nice, Heather from CIPD. So I think the HR community, I would say, plays a hugely important role here, and promoting and using standards which are also being developed by ISO in human capital. We had a nice session yesterday around this, plays a key role in helping employers and managers deal with some of these issues. And I think what's important here is workload, working hours, role ambiguity. We'll talk about these in more detail, but I think all of this together is the responsibility of managers. And I think Peter can sort of say a bit more about how line managers play a key role, because HSE has guidance for line managers and how they play a key role in promoting well-being at work.
Thank you. Thank you for the plug, Ali. Yeah, I mean, also if you look at this, workload, which is demands, role ambiguity, lack of control, support, relationships and change, so you'll find that these are all in the management standards, which are now teenagers. They were released in 2014, so 16 years ago. Line managers are absolutely 100% at the center of this. They're managed by people who expect them to deliver. They expect people below them to deliver, and actually all line managers are sometimes on two different levels of pressure, one from below, one from above. And actually line managers need to give them the right skills. You don't simply become a line manager and then go, I know how to manage everyone's emotions and their experience. That you need to look at training in the areas where you perhaps have got difficulty. If you're a shy and retiring introvert and you're asked to manage an extrovert, you're going to need to learn certain skills to manage that extrovert. I'm fortunate. I'm an extrovert. My boss is an extrovert, but I was managed by an introvert, and we had to find a way through that. You know what I mean? So I think the line manager is absolutely central. Why do we have the management standards work? Like just we put management at the heart of what we do, but we recognise that individuals have their own responsibility as well to tell their boss or to tell their manager when things aren't going right. And much of the suggestions that we have here for psychosocial risk could be psychosocial factors which are positive if they're managed in the right way. We will not eradicate stress, but we can control it. And that, I think, is the, we can learn to control elements of it. So, yeah, I hope that. And I totally agree with what David said in the chat.
So David in the chat has said he didn't realise that some of the problems created now may take a long time to surface, and it's good to make the point that some of the initiatives that are being put forward in our workplaces may not be the solution. And I think what we have on the screen at the moment, I think it's very unlikely that anybody in today's session in our audience won't recognise that workload, working hours, pace, deadline, ambiguity, lack of control, we all know as individuals, they affect our sense of confidence and wellness and happiness to get on with what we're doing.
What's interesting though, Sally, if you go to some people now and you ask them what are the stresses, we would have said demands, control and support, traditionally the model, high demands, low control, low support. What we're finding now through investigations with people is that people's workload has changed. So they're malfunctioning during these Zoom, they're doing these meetings. What they're really struggling with is the lack of control. And the lack of control that a pandemic brings is exceptional. And actually they don't feel supported when they're on a Zoom meeting or on a team meeting and they're doing this with their boss. One of the things I encourage, you're all welcome to come into at 2 o'clock every day, Monday to Friday, you can come and have a cup of coffee with me and have a bit of a chin wag. We'll talk well-being if you want, or we'll talk about your dog. But the point is, it's important to have those breakout periods when you're supporting people. Supporting people doesn't mean just checking in on Zoom saying, have you delivered the work? It's about actually asking questions like, not asking how you are, because they'll say, I'm fine. Well, why don't you ask him, on a range of 1 to 10, how's it going? How's it feel today? Because it opens up that conversation, and people need a different kind of support. The digital support, I have a beer with my boss once or twice a week at the end of the day. It's a different kind of support.
So essentially what I'm seeing as somebody who isn't a mental health expert is that there are really relatively small interventions you can make that can make a big difference. Is that right?
Yeah, absolutely
correct. I think all of these things that we have on this slide and the next one, which sort of talk about what the psychosocial risks. Psychosocial risks are sort of, it's not something that we have to avoid. It's basically something that we have to manage. Psychosocial risk means how work is managed and organized. We all have a role. Anybody in a managerial position has a role to play when you think about how work is managed and organized. And what we're in a way saying is what one would call good management practice. Being humane, being understanding, recognizing the ability. So, I mean, I would say, and from coming from sort of if I think of from an HR perspective, I think good HR practice, and I think that is what this is about. So, as you said, Sally, it does not require huge amounts of investment or huge amount of expertise, especially when you're looking at the primary and second primary level, where you are looking at prevention. So how we can make the work environment better, how we can improve job quality. And I think what's very important here, sort of linking back to what David said in the chat, is that things do take a long time to surface, because dealing with these issues, dealing with high workload, I think if you think about it, I think from your own experience, if I think about my own experience as well, when we cannot cope with workload, and if our workload gets higher, we can still cope with it. And over time, however, if that is not managed, then we start feeling that we cannot cope. And I think that's what's important to understand. In I think, again, in practice, I sometimes see the word good stress or use stress being used. Now, this was a term that was coined in 1954 by Hans Seeley. And it was used in a sense to say that when you are under pressure, so good stress basically relates to what we would say when you're feeling under pressure. So you need a little bit of pressure to perform, because that gets you going at the right level. However, if that continues over a long period of time, you reach a point where you break. That's when stress happens. That is what stress is. So stress is always negative.
Exactly. It's pressure. It's what pressure we assert on people. Yerkeson's Dobson Law, 1908, which says that if you have too much pressure, you burn out. If you don't have enough pressure, you rust out, and you get the same impact. So boring jobs lead to stress. High impact jobs lead to stress. What you need is a bit of pressure. So you need to, when you get up in the morning, or you need like at 10 to 2 and you at 10 to 3, and you can't get your Zoom meeting working, and you phone Sally and you text her. That's a little bit of positive pressure, and then you feel motivated and you're on it when you get on here at 3 o'clock. But if you can constantly on that pressure, you get to that. But stress is a perceived inability to achieve a desired goal. That is the definition that's routinely accepted. So there's some key words in there, inability and perceive. Okay, so it's what people perceive, and that I think we've got to get back to. I hate this conversation that people go, yeah, but a bit of stress is good for you. No, yes. What is good for you is a bit of pressure and enough pressure. And Sally knows this, because Sally constantly puts me under pressure at these 45,003 meetings. It's good, it motivates me, and I do that. But it's getting the pressure element right. And just because we're not going in the office, we're not traveling, the pressure, the digital pressure, the new digital pressure, is enormous, isn't it? Mm-hmm. To being online and being on all the time and looking beautiful and having to make sure you shaved and done all your stuff.
So can we talk a little bit about individualism? We don't all respond in the same way. Different things give anxiety to different people, cause stress in different people. The points that are on the slide at the moment, they're obviously general and generic and do apply to everybody to some extent. But can you give us a little bit about how we, in our organisations, whether we're managing or being managed, because I think the peer thing is also important, right? How taking into account individual needs is important, and what we can do about it. How can we manage that, because we're all different? Either one of you.
Yeah, I think I can get us going. I think it's a complex question. I think, of course, you have to.
Andy's a professor, so I'm going to let him answer it, and then
I don't think I can. I think it's there are multiple answers to this question. I think if I start off, I think you need to account for, of course, individual differences. However, when you're looking at an organizational level intervention for something like this, I don't think you need to necessarily go down to specific individuals. And let me explain that a bit. For example, when you sort of look at something like managing a certain amount of workload that a person takes on when they start a job, and everybody in the same job has a similar kind of workload. If you've selected appropriately, if you've recruited properly, following the right processes, if you've trained people appropriately, you are automatically giving them the ability. I'm not saying automatic, sorry, wrong word. I would say you are most likely giving them the abilities needed for them to perform on the job without them feeling unable to cope. And I think that's very important. I think what Peter said is very important to remember here. What we are talking about is that people are able to cope with the pressure. As long as people are able to cope with the pressure, we don't have a problem. Problems start emerging when people are unable to cope, and people are unable to cope when they are doing things which they are not trained for, or they haven't been given adequate resources for. That could be lack of support, that could be lack of equipment, for example, or even now, for example, things like I think I think lack of equipment and sort of being able to be working from home with inadequate access to the internet and so on has a huge impact.
Adi, it's not coping, is it? It's managing. It's how they manage. You give people the resources to manage, because coping puts it back to the individual to say, you've got to find a way to cope. Actually, you need to give the people the resource to manage the problem and to manage the issue that is there. And as a regulator, we expect you to do this. We expect you to manage both the individual and the group. So that's what the management standards implicitly says. You need to be doing something about recognizing the individual. So how do you help that person manage? But yeah, I mean, it's playing around with words. But when we say coping, we almost say you're responsible. You need to do
No, no, yeah, exactly. I mean, I'm not saying that, of course, the individual is responsible for the coping. It's basically giving them the resources so they are able to cope with it.
Yes, absolutely.
Yeah, so that, yeah.
So we're in a strange situation at the moment, right? Some people's job roles have had to change. What is being asked of them is different.
Yeah.
There hasn't always been time to train people to do it or provide additional resource. In healthcare, people have been put into a whole new world where there used to be a handful of specialist people who worked like that. Suddenly now everybody's got to work like that. So it's not anybody's fault that we weren't ready. It's not that these members of staff aren't suitable or able to cope with pressure to a degree, but we still have an issue because it's relentless.
That's true. And no, that's absolutely true. I think it's I mean, if I just take the university as an example, I think when the lockdown happened and when we had to move all of a sudden to online teaching, a number of we have been using online resources, but teaching online is a completely different thing. And how do you switch within a week to delivering good online teaching without the adequate training? So of course everybody feels affected by that, and it's nobody's fault here. So I think, but these I would say are extreme situations. I think what's happened due to the pandemic is quite extreme and sudden. But I think if you look before the pandemic, and I think in the world following the pandemic, we are more aware, and we can plan better. So these situations can be dealt with better. I think, if you look at, I think again, CIPD does amazing work here, and sort of look at the research which talks about how much companies invest in training, how much they invest in recruitment, selection, and learning and development, and so on. And I think it shows that this is not something that is given enough attention. And I think investment is not adequate for these things. So I think it's not just a matter of employers not always understanding. I think it's also a matter of us as experts, and I think the role standards can play here, hopefully, is create that awareness to show that there is a clear business link here. That by investing, there is a return on investment, because it's linked not just to how training and development, for example, helps staff be more productive, but also help staff be able to cope better, which then does not have a negative impact on their health and well-being. So I think we have to see things more broadly, because I think what's happened is over the years, we've become very siloed in our thinking. I focus on one area without thinking what the consequences or benefits are to another area. And I think that's where we need to sort of, I think, rethink a bit.
Sorry, can I just interrupt for a minute? Because we're going to go on to talk about 45,003 in just a second. But I want to come back to Adi's point about, he just said about before and after. What I would like you to both to give our audience today is 2 or 3 takeaways for now. What 2 or 3 actions can people do now to help each other and themselves?
I'll do 2 or 3, and I'll just quickly answer David and Robin's question. In answer to David's question, there will
do you want to read it out so everybody knows it?
If government or HSE can provide simple messages to employers about long COVID creating great anxiety as they recover, which means those returning to work will need extra support. I know there is guidance currently being developed around, specifically around those long COVID, which will be a cross-government advice, which will include mental health as well as the physical characteristics of long COVID. And do you think the pressure threshold is difficult to know in the sense that it may vary between people? Well, yeah, of course it's difficult to know. But the point is, if you do an organisational wide assessment of where you are with your psychosocial risk, and you've got 15 people in the department that only have 20 people, then you've got a problem. If you've got one person, you've still got a problem, but you know where to target resources. So the individual variability comes into play in that. And the 3 take-home things is you've got to make mental health real and normal. Why is it when I go into work, I attach the key emotional traits that we have, which is compassion, caring, and loving? Why can we show that at home, show it to a friend, but when we go into a workplace, we say we can't do that? So be there and think about how to look after my colleagues. C is like a social workplace being fundamental as a cog is in the wheel to what happens to the success of that business and how that business functions. Your people need to be protected physically and psychologically at work, okay? And we do that by addressing obviously. And the third one is you've got to invest in time within work, which is what I would call social. Right? So you get away from the rigidity of what's going on and you have moments together. Because when we were going into the office, we would routinely stand in the kitchen and talk to people, didn't we? It met some functional need. My boss has said I never at my desk. I was always talking to people and always having a cup of tea. That's fine. But you see, for me, human contact's really, really important. So I have to leave at quarter to. You remember? Yeah.
I do remember. So let's get a move on.
I have another webinar to do.
You're in demand because it's a big subject.
Yeah.
Go ahead, Adi. A quick couple of pointers for people to take away, practical tips, please.
I think the easiest and I would say the most important thing that people need to do is have good communication. Especially if you're managing a team, make sure you're communicating with your team. And when I say communicating means good communication is honest, open communication. Be as transparent as possible. I think that means a lot to most people. I think all of us appreciate when somebody talks to us honestly, even if it might not be necessarily positive, but I think we appreciate honest and transparent communication. And I think, and I think the second thing, of course, is that recognize that this is not necessarily hugely difficult to do. These are simple things. I think it goes back to what we said before, Sally, that they are easy, simple things that we can do, which did not require huge amounts of resources or huge amounts of expertise to actually implement. So I think every organization is different. And I think it's recognizing what matters. And again, that goes back to talking to people. People will tell you what needs to be done. And these things can make a big difference. Small things can make a big difference.
So remember the human element,
Precisely.
basically.
Absolutely.
Let's remember we're all human beings.
Yeah, and don't be scared to go back to your people, because your people come up with solutions which are way more cost effective than what you think they should have. And trust me, time and time again, they go, I never thought about that, because they didn't. And they talk to their people, and the people say, well, if we just click this box, that can make a massive difference to the way we're working. Having the conversation with people is really, really important.
And one thing I would like to raise, and it sort of relates to David Smith's follow-up question about being concerned that people working at home will be seen as okay. A conversation I had recently was, it's not a competition. You know, the people working in ICU units in hospitals at the moment are under tremendous pressure, and we know that their mental health is suffering right now. But it doesn't mean that you, who are in the privileged position of being able to work from home effectively, aren't suffering also. And I personally think it's very important that everybody's level of anxiety and concern and feeling is recognised as valid right now. Would you agree with that?
Absolutely. I think what's happened as a result of the pandemic is, I would say, work home interface was always important part of the psychosocial work environment. I think because we are working from home does not mean we are more comfortable. I think most people find it difficult to work from home because most of us don't have the right requisite spaces at home to continue working full time. I mean, it's different. Those with parental responsibilities or child caring responsibilities have to deal with far greater issues than working from an office. And I think also there are issues around feeling lonely. Isolation has become an increasingly important issue that has to be dealt with. I think this is, so it goes back to the importance that we maintain good, effective communication. So yeah, I think working from home definitely is not a luxury, and I think it shouldn't be seen as one.
You know, it's fascinating. If you put someone on a desert island, you ask them what they want. It's not freedom; it's the ability to control that freedom. And in the context of working from home, we might have all wanted to work from home, but we wanted the choice when we worked from home, and we wanted to know when we did it. You see, so actually, we come back to the old little adage about control kicking around at left, right, and centre. You know, the 20% of the increase in depression and the 2.8 million days lost and the 220,000, they're not all key workers. By and large, there are a variety of sectors. What we do have in the healthcare sector is internationally something in the region of about 22% sickness absence due to depression and anxiety in this COVID period. The numbers are epic. I mean, absolutely phenomenal. If you want to have a look at the study, Kelsey in the BMJ 2015 May, Kelsey et al., where it talks, at which there was a meta-analysis of healthcare workers. So, but yeah, loneliness and isolation are a key element. I feed the birds in my back garden now. I've named them. That tells you, you know, I live on my own, and that, you know, they're my connection with human nature unless I go for a walk. Okay.
We saw a news article today, didn't we, about a man who started talking to his chairs because he doesn't have anybody else to talk to. People are coping in their own ways with this isolation.
Yeah, I haven't started talking to my chairs yet. But,
you've got birds, you're okay.
I've also got 2 squirrels as well. They tell you what, they give her a bag of nuts. I'll have to go in about 2 minutes, but yeah. Sorry, I'm only sharing about the squirrel thing, but they are really, it's really good when you're alone in your own place to have connection with something and someone, even if it's an animal.
Yeah, connection, very important. Let's, we know we've got to say goodbye to you, Peter. I hope your next webinar goes well. Thank you for joining us today. And to all of our audience, if you have any questions for us, if you want to interact with us, you can get in touch with us after this event. And we will do our best to support everybody with tips and advice. And
if they're on LinkedIn, join my LinkedIn coffee at 2 o'clock. If you're not on LinkedIn, accept me on LinkedIn and come and have a chat at 2 o'clock. I'm happy to, yeah, as long as you bring a coffee and a chocolate with you or a biscuit, then we're on it. And so, yeah, but thank you for the opportunity, Sally, and I'll let you wax lyrical about 45,003.
Thank you, Peter, and we'll see you in the next meeting of 45,003 very soon.
Yes, you should talk to them about the 2 weeks of meetings on webinars that we have to do for these. So this is where we get the very practical application of what we've talked about when we have Zoom meetings that last in multiple countries, 2-3 hours a day, sometimes at 12 o'clock at night. I'll see you later.
Indeed.
Bye
See you
bye.
later. Goodbye. Okay, so Aditya, it is me and you.
Yeah.
Let's talk about how standards can help at this time. And I think it's worth pointing out that the draft public consultation, although that consultation period is now over, people can still buy that draft from the BSI shop, and it's very low priced. It shouldn't be a barrier, the price. And with a 95% approval rating, you can be confident that the final published standard will be similar, extremely similar. It's not going to be very different technically when we get there. Okay, so Aditya, do you want to give us a bit of an overview of what the standard does?
Okay, so I think it's as we sort of put on the slide here. I'd basically start with probably what the scope of the standard is. So the standard is a guidance document which supports the implementation of ISO 45001, which is the management system standard on managing occupational safety and health at work. And what ISO 45000 does is it provides guidance with respect to managing psychosocial risk within occupational health and safety system to enable organizations to not only prevent injury and health, but also to promote the psychological health of workers and promote their well-being and engagement at work. So it has a very clear scope in terms of it acknowledges that this is about improving conditions at work, and I said conditions means the environment within which people work in, and how the different aspects of work. We have 3 different areas that the standard looks at. It looks at how work is organized, social factors at work, and work environment, equipment, and hazardous tasks. So it helps organizations identify the conditions, circumstances, and workplace demands that have an impact, that can have a potential to impair psychological health and well-being. And it also helps organizations identify primary risk factors. It gives them guidance on how to assess them and what changes might be required to improve the work environment by putting in a range of interventions or management controls. Finally, it allows organizations to do this as part of their general broad occupational health and safety management system. So this is not something they have to do as an add-on. It needs to be integrated within an organization's health and safety, occupational health and safety management system.
This is worth stressing, isn't it, Aditya, that 45003 isn't an additional management system standard. It is one that supports ISO 45001. But equally, if you have not implemented 45001, there is useful guidance in here. You need to look at your workforce, your workers, the people you're with in a holistic sense. So, deal with them as whole people. We are not just a broken leg and separately some anxiety and insomnia. They all go together and they impact on each other. So I think it's really important to stress that. As I mentioned, we've just finished the consultation period. We got a very high level of approval, which is fantastic. It's taken a lot of iterations and many hours, days, weeks of discussions, months, in fact, to reach 95% approval across the 70-something countries that voted on this draft. The final revisions, as Peter mentioned, we will look at the 441 comments that we received in December in a series of Zoom meetings. And as Peter said, it's a very good example of managing psychosocial risk in a practical application. We have people who will be joining with some negotiation on time zones at 10 p.m. at night for these 3-4-hour sessions, others who will be starting at 4 a.m. It's incredibly hard, but that pressure is not stress, as was discussed earlier. if we limit how long it lasts, if we give clear parameters, if we recognise when people are tired and not functioning properly, and perhaps call the meeting to a halt a little bit earlier or give extra breaks. But this will be going on in December. There's a strong likelihood that there will be some technical change made to the draft, which will mean we will have a final draft international standard ballot, an FDIS ballot, and we will publish in the summer. It definitely shouldn't publish later than the summer of 2021, but if you need it now, go to the BSI shop, pick up a copy of the draft, because it is technically good. It is technically accurate. Okay, I've rather rushed us through that because we only have a few minutes left. At the moment, I'm not seeing any questions. If anybody would like to ask any more questions on this, please do. While I'm just waiting to see if any of those come in, let's just have a look at other resources that may help you at this time. So ISO 45001, of course, it is a broad risk-based management system standard. Health and safety has never been more important in the workplace than it is right now. Everybody needs all the tools they can get. It isn't about certification, it's about knowledge and it's about implementation. So if you haven't ever looked at it, it is worth looking at and seeing if it will help you manage the situation you're in now and what will come after. We've also got a free guidebook, a practical guide, a little book of health and safety management, which is available for free download from the ISO TC283 website and from the BSI site, which is a really good introduction to health and safety for people who just aren't experts but know they should be doing something. There's a handbook that helps ISO 45001 implementation, and there are a series of British standards which go into a little bit more depth on specific topics within 45001, specific aspects of your health and safety management system. Now, we've had a question through from Paul Robbins. How will the effectiveness of the standards be measured? It's a really good question. It's hard to measure, particularly psychosocial risk. Aditya, do you want to say anything to that?
Yeah, I think so. As I said before, the ISO 45003 is a guidance standard. So you don't necessarily measure the effectiveness of the guidance itself. What you can see, or what we hope to see at least, is that organizations which implement and go through implement 45001, and 45001, of course, is an auditable standard. With this guidance, what we hope to see is that organizations also pay adequate attention to this specific issue, because psychosocial risk, although being part of occupational health and as a recognized as occupational health and safety risk, is not often seen as such by organizations, and they don't do enough to manage this risk as compared to other occupational risks. So what we hope to see and what would show effectiveness is that organizations start managing psychosocial risks more effectively. So that would, I would say, indicate the effectiveness of this specific standard. I also want to sort of just mention in relation to so some of the other documents, and sort of relates back to what we were saying earlier. There are also other ISO standards being developed, which I think are important. I think, again, goes back to sort of in large organizations which have big health and safety departments, they'll be implementing standards like ISO 45001. Large departments, large companies also have big HR departments which might be implementing the HR standards. I think there needs to be a dialogue between these different departments and users of these different standards. There are a number of ISO documents that are already guidance documents and other kinds of standards already out there. Standards such as guidelines on human governance, ISO 30408, ISO 30409 on workforce planning. All of these are very relevant to this issue as well, because they help you manage some of these. They don't talk about health and well-being specifically, but they're talking about aspects of the psychosocial work environment. Similarly, a standard being developed in employee engagement is very closely related to this one, the standard on learning and development. So I think it's important to recognize and remember that there is a very clear linkage between these things. They don't happen in isolation.
Thank you very much, Aditya. Matthew Charles has reminded me, as much as the audience, that there are also a series of podcasts available from BSI, two of which touch onto this issue. You can listen to them anytime you like, and it might also be a useful resource for people within your organisation who perhaps are never going to pick up the standard and read it from end to end and implement things, but may want a little bit more understanding of the general issues and what they can do to help themselves and other people in this time. I believe we are completely out of time, Aditya. So I want to thank you very, very much for being with us today. Don't forget, everybody, you can download the free Safe Working Guidelines, which does cover psychosocial risk to a certain extent. It's not a lot, but there are some pointers in there for the pandemic. And also you can get in touch with us through the conference team if you would like anything, if you have any specific questions that you feel we could help with. Thank you very much.
Thank you.
Bye.
Bye.